Good morning. Thank you so much for your wonderful response to the discussion question for this week. You had mentioned the chief complaint as one of the benefits, and I did talk about this a little bit during our class session this week, which is available as a recording. But I thought I'd just pull up an example of this in SimChart and talk a little bit about how the chief complaint tool benefits the physician and the patient. So the chief complaint is the main reason a patient is seeking care, and you can see we have a data entry box to enter that information, and we typically use at least a portion of the patient's own words. And then following that, we have a history of present illness section that really guides the physician in collecting, or the clinician in collecting details about the issue the patient is having. And that includes location. So this is where knowledge of the body comes in handy. For example, the abdominal quadrants. Quality would be a description of the pain. Is it a sharp pain, a stabbing pain, throbbing, something like that. Severity is typically the degree of pain. We often use pain scales for this, 1 through 10. Duration would be how long the condition has been happening. And timing would be when the pain happens. Is it intermittent? Is it consistent? Is it after meals? Is it in the evening? Is it when the patient lays down? Context might have something to do with what the patient was doing when the pain started, for example. Modifying factors would be things like, what helps ease the pain, things like that, medications, different actions, maybe laying down helps mitigate the symptoms, and then any associated signs and symptoms. And then we also have a review of systems here that's broken down by body system. And again, this is just a really great guide to prompt the clinician to ask about common signs and symptoms as organized by body system. So if this patient happens to be having, let's say, some stomach issues, then we know that, perhaps we're going to pay particular close attention to the gastrointestinal common signs and symptoms. And again, this just helps guide the physician in asking about some of the most common signs and symptoms that a patient might face. So I just wanted to share a little bit more about that really awesome tool you mentioned. Obviously, this helps guide the clinician and prompting them to ask important questions, and kind of helps keep that information organized. So again, thanks so much. Hope you have a great day.